You ain't nothing but a hound dog, you're crying all the time. You ain't nothing but a hound dog, crying all the time.
This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to show you the steps to perform pet CPR. CPR is the most important first aid technique that every pet owner should be comfortable with. Chances are you'll never have to use it, but it can save your pet's life. There are some very basic steps. Step 1, assessing responsiveness. Step 2, establishing a patent airway. Step 3, performing rescue breathing. And Step 4, cardiac massage, where you're establishing circulation. Step 1, responsiveness. The first step is making sure that your pet is truly unresponsive. Check his breathing by placing your hand in front of his mouth and nose. Check for his heartbeat by placing your ear against the left side of his chest. This is where his left elbow touches his chest, behind his left armpit. Check to see if your pet is breathing by placing your hand in front of his mouth or his nose. And then secondly, check to see if there's a heartbeat by placing your hand or your ear in behind his left elbow on his chest. Just how I'm doing here with Lewis. Step 2, airway. The second step in CPR is obtaining a patent airway. Pull the tongue out of your pet's mouth, but be careful not to get bitten. Straighten the neck by moving the head to be in line with the neck. Perform 2 rescue breaths by closing the mouth and performing mouth-to-nose ventilations. If the chest expands, then proceed to Step 3, breathing. Step 2 is ensuring that your pet's airway is open. So what I want you to do is put your hand around your pet's muzzle, closing his mouth, putting your mouth over top of his nose, performing 2 breaths and actually seeing his chest rise. If his chest rises, then we know his airway is open, and then we can proceed to Step 3, breathing. Step 3, breathing. After achieving a patent airway, perform rescue breathing. Close your pet's mouth and breathe directly into his nose until his chest expands. If the chest doesn't expand, then go back to Step 2, airway. Ventilate at 8 breaths per minute. That's 2 breaths every 15 seconds. Then proceed to Step 4, circulation. In Step 3, breathing, we're putting our hands around your pet's muzzle, putting our mouth directly over top of their nose, performing 2 rescue breaths. We're breathing for them at the rate of 8 breaths a minute. That's 2 breaths every 15 seconds. Step 4, circulation. Ensure that there are no major points of bleeding. Control is necessary. Gently lay your pet on his right side. Locate the heart, which is found in the lower half of the chest on the left side, behind the elbow of the front left leg. Compress the chest 30 times, followed by 2 rescue breaths. That's 4 compressions every 2 seconds. Compress the chest at ½ an inch for small pets and 1½ inches for large pets. Every 30 times, follow up with 2 rescue breaths. Continue heart massage compressions and the rescue breathing until you hear a heartbeat and feel regular breathing. Step 4 is circulation. So first, lay your pet on his right side. Locate the heart, which is found in here behind the left elbow, between the 3rd and 6th rib spaces. And then what I want you to do is put your left hand here, right on top of that heart. Put your right hand on top of that left hand. And you need to compress it quite deeply. So for a large dog, we need to compress that chest wall 1½ inches. For a smaller dog, we're compressing it 1/2 an inch, or a cat. And the rate what we're doing at is we're doing 2 compressions a second. And every 30 compressions, we're going to follow that up with 2 rescue breaths. So I'll compress Lewis's heart here 30 times quite quickly. And that'll be in 15 seconds. Then after 15 seconds, I'm going to follow that up, closing his muzzle, putting my mouth over top of his nose and blowing him twice. And then you're going to keep that rhythm up. You're going to keep that 30 compressions, followed by 2 rescue breaths, until your pet's heart starts beating again and he starts breathing. Thank you for watching this edition of Veterinary Secrets. What I want you to do right now